you are in the best of your health. Today we will be discussing about the laparotomy instruments. So over to instruments. So this instrument is known as sponge holder. So usually it is used to hold the sponge. So this is known as sponge holder. Now coming toward the next instrument, this is known as LSS. So this is known as LSS, and it is usually used to hold the strong tissues or very hard tissues. So this is known as LSS, and this is known as BABCOCK forceps. The end is bit blunt, and this is known as BABCOCK forceps, and usually it is used to hold for the delicate tissues. The difference is the LSS is used for the hold strong tissues, and the BABCOCK is used for the delicate tissues, and this is known as DEAVER retractor. So these are the large DEAVER retractor. This is the medium size DEAVER retractor, and this is the small DEAVER retractor. Usually it is used to hold the abdominal wall and abdominothoracic procedures. Now these are the different artery forceps. So this is the large curve artery forceps. You can see at the end it is a bit curved. So this is large artery forceps. This is small curve artery forceps, and this is straight large artery forceps, and this is small straight artery forceps. So these are the artery forceps, and usually it is used to control bleeding from blood vessels by clamping artery. Now this is known as pull suction. It is usually used to clear the secretions. Now this is known as scissor. This is simple scissor. Usually it is used for the cutting for different and various tissues, and this is known as BP handle. It is also known as incisional handle, as it is used for the incision. Now these are the different forceps. This is the plain forceps, and this is the tooth forceps. The difference is that this is continuous vertical lines and the plain forceps, and this is a bit teeth end at the terminal portion. So this is plain forceps, and this is tooth forceps. Now it is usually used to hold the skin. Now this is known as needle holder. How you will identify the needle holder? By just looking upon the horizontal line over the continuous vertical lines. So this is known as needle holder. It is usually used to suturing a needle. Now this is known as SCISSOR retractor. Why it is so called SCISSOR retractor? The reason is that it is a bit Z-shaped. So it is usually known as SCISSOR retractor, and it is usually used in hernias and laparotomies. And this is towel clamp, and this is known as right angle artery forceps. You can see that it's a bit 90 angle at the terminal portion. So this is the right angle artery forceps. This is also a right angle artery forceps. It is usually it is used to control bleeding from the blood vessel by clamping artery, and this is known as instrumental clamp, usually used for the different instruments in order to clamp. The kidney tray, we usually use to hold the different bandages and small instruments. So that's all for today. Thank you so much.